Yeah.
Okay, so when somebody comes down, give me a whole protocol here. Like, because
Okay.
I've sent you several clients already.
Mm-hmm.
One woman went down and she had, what was it, cancer?
Mm-hmm.
And,
So that's a completely different treatment. That's immune therapy. So that is basically with that kind of treatment. Immune therapy can also be used for autoimmune diseases. So basically with that, we're adding T cells to the body. Different types of T cells, reg T, killer T.
and what's a T cell?
So T cells are immune cells. So basically, with a cancer patient, we're gonna program the T cell to go directly after the cancer. So instead of chemo, which is like an A bomb going into your body, this is like SEAL Team 6 going into blastosoma.
I love that.
Yeah. So we're actually clinics in the US are now doing this type of treatment. I had a good friend of mine, he owns the cigar lounge I go to. His mom received immune therapy at UCSD because they're starting to use it for certain blood cancers here in the US, and she got amazing results from it.
Wow.
Yeah, so it is becoming more mainstream in the US. It just, it's taken a lot longer because the system here is you can't. Stem cells are natural, so no drug company can go in and go through the system and
try to monetize it.
Yeah, so it's very different, and that's that's part of the reason why it's not so big in the U.S. And then also it's very effective. You can treat degenerative diseases and especially like joint issues like that.
Like getting T cells.
For stem cells.
Stem cell. Okay. Okay.
Yeah, so you can treat all these diseases, and then instead of people having to take pills and be a perpetuity for Big Pharma, they can be healed.
They can actually be healed.
Yeah.
Rather than masking the symptoms. All right. So, and we're going to get on that. Let's not forget, we're going to get on our current quote unquote healthcare system, aka disease management system. We're going to get on that. We're going to go off on that. But I want to stay on the stem cells and I want to talk about the T cells more.
Okay.
So you're saying, because I have there's quite a few people, unfortunately, in my life, especially my clinic, my wellness center here, that are either getting cancer, and the majority of them are choosing the chemo and radiation route. And obviously, this is the information that we're sharing is like, don't go by what we're saying. We're just talking.
Everyone's very different.
Do what you think is best for you and your family. But I've read and heard and researched that chemo is like an 87% failure rate. This is what I'm studying and finding out, right? But yet the system is still telling people that's the only route to go. Our system in America.
Yeah.
Look at the face. Okay, so what you're saying, like what you do, especially with the T cells, you can go actually directly after the cancer cells. Is that correct?
Yeah. It's a very complex process. Basically, you go in, you get blood drawn, and it's kind of like a vaccine of your own body. So the lab will work, and they multiply your T cells, and then a couple weeks later, once they're multiplied, they're applied back into the body, and then it's a sequence of a certain amount of treatments. But yeah, it's a very, very advanced process.
And so, in your experience, we don't guarantee results here. Disclaimer. Have you seen that you have significantly helped people get rid of cancer, minimize it? What has been your experience, and what have you seen so far?
Yeah, so typically, most of the people that come to us are terminal. So
Really?
they've already been in the U.S., they've been treated with chemo. You have to be off chemo for a certain amount of time before you do this therapy. So
how much time? Do you know the time?
The doctor. I'm
Several
not
months.
A doctor. I know the basics. So
Okay.
I'd guess at least 8 weeks.
Okay.
But like I said, every patient's different, and the doctor's the one who determines those decisions.
Okay.
So most of the people that come to us are terminal.
By terminal,
stage 4.
they've tried chemo, radiation. The doctor says you're done.
Yeah, stage 4, and then the U.S. system says, yeah, you're finished. So we've
get your affairs in order.
Yeah, basically last year we saved 4 out of 6 patients.
4 out of 6 that were terminal. Whew. Wow, that's a good percentage.
Yeah, but it's tough though, because my mom has a CLL, which is it's a the lowest form of blood cancer, and she did chemo and it's worked great for her.
It did.
But she does have the low energy and the side effects.
Yeah.
So different things work for different people. But yeah, we just want to let people know there's more options out there.
And that's on. Let's talk about that real quick, because you've got two decisions. You've got two choices, really. You can go the natural route, and for what I'm seeing, hearing, that's more of a kind of a pleasurable route, because you're actually increasing the health in your body and the immune system of your body, right?
Yeah.
Or you choose to go the I'm going to say it, the poison route, to poison your body, that hopefully actually poisons the cancer also, but then your side effects are feel like hell, like really bad.
Well, side effects are high. Then it's also, chemo's pretty expensive. And,
super expensive.
Insurance pays for it, so that's just a perpetual cash flow for the companies that make it.
Yeah, big time.
Yeah,
because I've heard that doctors actually get a cut off chemo.
Yeah.
Is that correct?
I've heard, for a lot of drugs. Yeah.
And chemo specifically is one of them. Like they get a nice cut from chemo, because chemo's super expensive.
Yeah.
And the doctor gets a cut for referring it.
Yeah, and it's the same thing with joint stuff. You know, every surgery they perform to replace a joint, it's like $40,000 to $70,000 to replace a joint. And then once you replace that joint, there's no going back. So
that's it.
Yeah.
That's crazy.
But like I said, it does work. My dad got his hip replaced, but he waited 15 years to do the surgery.
Too long.
So he's probably past the point of no return. And stem cells aren't going to work for everyone. If you're past the point of no return, when you have less than 20% of soft tissue in that joint, it may not work for you, you know?
So,
but the only risk is, you know, if you're below that, you might lose some money, but it's better than going under the knife and taking a chance.
Right.
You know?
Yeah. Yeah, because my mom had her hip replaced, and like you said, it was fantastic. She went from pain all the time to feeling great.
Yeah, it's amazing.
Yeah, and so again, let's talk about that one again. So what you're saying is, like, any type of, like, a shoulder, like it's a shoulder issue, a hip, a joint, if they get to it early enough, stem cells can help.
Yeah,
and most likely will.
Yeah, 100%. Yeah.
And how does this? So the stem cells. Talk to me about, how does a stem cell help? What is it? What's the most common one? Knee or hip? Probably hip, right?
Knee. Probably knee.
Knee.
Knee's
okay.
very common. Yeah, but knee, shoulder, hip, all that stuff is very common. I mean, I did my shoulder. The first time I ever treated myself with stem cells was the shoulder. And when I say treated myself, I'm not saying I injected them in there. The doctor did it for me.
Yeah. Yeah.
So basically, when you have issues in there, you're injecting blank cells in there, which are they go to where the inflammation is, and then they start the healing process, and they have the ability to turn into the cells that are damaged. So you put stem cells and exosomes into the joint.
And exosomes. Before you said it's one or the other, or can you do them both?
No. You can do them both with PRP too. So PRP has your own genetic material in there. So it's
plasma-rich.
Platelet-rich plasma.
Platelet-rich plasma.
Yeah. So... Right. And PRP can treat joint injuries, but they can't really heal joint injuries.
Really?
Because stem cells are actually going to rebuild the tissue. The PRP works, has a bunch of growth factors and other things that are good for you, but stem cells actually can turn into the cells that are damaged and missing, whereas PRP doesn't have the capability of doing that, really.
So PRP... platelet-rich plasma. Go through the procedure. Do you guys do that too, PRP?
Yeah. Oh, yeah.
So walk me through that process. How does that work?
So basically with PRP, you draw your own blood. It's placed in a spindle. It's spun around, and when it's spun around, the platelets are separated. So basically the high plasma is separated from the rest of the blood, and then you inject the high plasma platelets into your injury. And it's very, like I said, it's very, very effective.
I've heard it's very effective.
It's nowhere near the level of stem cells and exosomes, but we do like to put PRP into the joint with the stem cells and exosomes due to the fact that it has your own genetic material, and it helps a lot with all these things when used together are very synergistic. So PRP alone, let's say it's a 3 out of 10. Stem cells alone, a 20. exosomes maybe a 10, but when you put all those together, it's a 200.
Wow.
So that's kind of how these things work together. They work very synergistically together. And then when you add other things like DMSO, that helps with cell permeability. So it helps the stem cells and exosomes work better.
What's DMSO?
It's a compound that we use with basically the day before we're applying the stem cells, we're preparing the body for the stem cells. So DMSO is a very common one. It helps with cell permeability. And then based on the patient's blood work, other IVs will be applied on the first day. And then on day 2, that's when we apply the biologics. So stem cells, exosomes. We'll also do hyperbaric oxygen on day 1 and day 2 because hyperbaric oxygen compresses your body and pushes the stem cells into the capillaries. So it compresses it, and then 2, it hyperoxygenates your body. So you're basically in a superhuman state of oxygenization.
Yeah.
And hyperbaric oxygen alone helps with joint pain. So
joint pain, everything.
Yeah, it's amazing. I love HBOT.